Colon cancer may not be talked about as often as other cancers, like breast cancer, prostate or lung cancer, but it's actually one of the leading causes of cancer deaths. It is for this reason it's very important to stay on top of your colon health. The colon is your large intestine, the long, upside-down U-shaped tube that is toward the end of the line for getting rid of waste in your body. Colon cancer can start in the lining of the intestine, or at the end of it, called the rectum. Let's try to better understand colon cancer. You're more likely to get the disease if you're over age 60, especially if you have a family history of colon cancer, inflammatory bowel disease, diabetes, or obesity. Smoking cigarettes and drinking alcohol has also been found to increase your risk of getting colon cancer. Although the data are not consistent, eating red meat or processed meats may increase the risks of colon cancer as well. Lean, unprocessed red meat may be associated with less risk. If you have symptoms, they may include pain in your abdomen, blood in your stool, weight loss, or diarrhea. But hopefully, you'll get diagnosed before you have any symptoms, during a regular screening test like a colonoscopy or sigmoidoscopy. These tests use special instruments to see inside your colon and rectum to look for any cancerous or precancerous growths, called polyps. If your doctor discovers that you do have colon cancer, unfortunately, you'll need to have a few more tests, including scans of your abdomen to find out whether the cancer has spread, and if so, where in your body it's located. So, how is colon cancer treated? That really depends on how aggressive your cancer is and how far it's spread, but usually colon cancer is removed with surgery or killed with chemotherapy or radiation. You may get one, or a combination, of these treatments. Colon cancer is one of the more treatable cancers. You can be cured, especially if you catch it early. Spotting colon cancer when it's still treatable is up to you. If you're over age 45, you need to get screened. And, regular physical activity and eating at least some fruits and vegetables daily, perhaps with unprocessed wheat bran, can help prevent it. If you want to prevent colon cancer, you'll also want to avoid processed and charred red meats, and smoking, and excess calories, and alcohol. So here are some causes. Nearly all colorectal cancers begin as non-cancerous, benign, lumps, polyps, in the lining of the colon and rectum. These can slowly develop into cancer. You have a higher risk for colorectal cancer if you are age 45 or older, drink alcohol, smoke tobacco, are overweight or have obesity, are African American or of Eastern European descent, eat a lot of red or processed meats, eat a low fiber and high fat diet, have a diet low in fruits and vegetables, have colorectal polyps, have inflammatory bowel disease, Crohn's disease or ulcerative colitis, have a family history of colorectal cancer. Some inherited diseases also increase the risk of developing colorectal cancer. One of the most common is called Lynch syndrome. Now let us talk about symptoms. Many cases of colon cancer have no symptoms. If there are symptoms, the following may indicate colon cancer: abdominal pain and tenderness in the lower abdomen, blood in the stool, diarrhea, constipation, or other change in bowel habits, narrow stools, weight loss with no known reason. Here are some treatments. Treatment depends on many things, including the stage of the cancer. Treatments may include endoscopic surgery, less invasive surgery using a lighted, flexible tube, surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy, surgery. Stage 0 colon cancer may be treated by removing the tumor using endoscopic surgery, colonoscopy. For stages I, II, and III cancer, more extensive surgery is needed to remove all or part of the colon and rectum that is cancerous. This surgery is called colon resection, colectomy. Chemotherapy. Chemotherapy involves taking medicines that kill cancer cells. You may receive just one type of medicine or a combination of medicines. Most people with stage 3 colon cancer receive chemotherapy after surgery for 3 to 6 months. This is called adjuvant chemotherapy. Even though the tumor was removed, chemotherapy is given to treat any cancer cells that may remain. Chemotherapy is also used to improve symptoms and prolong survival in people with stage 4 colon cancer. Immunotherapy. Immunotherapy involves taking medicines that increase the ability of your own immune system to destroy cancer cells. Immunotherapy has different side effects than chemotherapy. Radiation. Radiation therapy involves using radiation to kill cancer cells. Radiation therapy is often used in the treatment of rectal cancer. Targeted therapy. Targeted treatment zeroes in on specific targets, molecules, in cancer cells. These targets play a role in how cancer cells grow and survive. Using these targets, the drug disables the cancer cells so they cannot spread. Targeted therapy may be given as pills or may be injected into a vein. You may have targeted therapy along with surgery, chemotherapy, or radiation treatment. Like, share, subscribe and comment.